homelessness and mental health. Members: Quinnica Hodges, Stephen Kendrick, Marcus Langston. Growing up as a child, nobody ever thought about ending up on the streets. Being homeless is the last thing on anybody's mind, but it happens. More teens and adults are becoming homeless. There are families on the street daily because they cannot pay their bills or have lost their jobs. Mental illness is something that people do not know they have. People are not aware that they may be ill. Lack of medication can drive them onto the streets. In this PowerPoint, we will discuss what homelessness is and how having mental health issues are a dangerous combination. Assessments of homelessness and mental health. Between 1/4 and 1/3 of homeless persons have a serious mental illness such as schizophrenia, bipolar disorder, or major depression. 20 to 25% of homeless population in the United States suffers from some form of severe mental illness. Mental illness was the third largest cause of homelessness for single adults. Morality of homelessness and mental health. Risk factors. Mental disorders prevent people from carrying out essential aspects of daily life, self-care, household management, and interpersonal relationships. The recession will increase 1.5 million more people. Policy. New York/New York Agreement. Third, the New York Department of Health Service annual budget is $1 billion and 2,000 employees. Collaborates with public agencies, nonprofit agencies. New York City programs have become the national model by reducing New York homelessness by 59%. Three versions of the New York/New York NY agreement. Version 1, a result of 11,000 single adults in shelters, many with serious mental illness. NY/NY2 resulted in 1,500 housing units for mentally ill homeless. NY/NY3, state/city joint investment of $1 billion for 9,000 housing units. Policy. New York/New York 3 agreement programs, safe haven programs. Temporary housing mandates is different than other city programs. Every eligible man and woman and child are housed overnight. Street homelessness and outreach engage homeless to encourage them to move into housing have resulted in 28% fewer homeless. Prevention assists with immediate housing but maintains effort to develop long-term plans. Critical objectives, employment-focused programs to prevent homelessness. Leaders in policy development, New York City Housing Authority, New York State Homes and Community Renewal, New York City Housing Developmental Corporation. Assurance. The federal government has extended the National Partnership Agreement to Homelessness to June 30, 2015. However, the funding must be matched by a commitment of $2.8 million. Homeless Bills of Rights, a new and powerful legislative tool for protecting the rights of homeless Americans, are gaining in popularity across the nation. Homeless Bills of Rights have already been enacted in Rhode Island, Connecticut, Illinois, and United States temporarily of Puerto Rico. The legislation has been proposed in several other states across the country. These bills are not protected against common forms of discrimination. They can help people experiencing homelessness realize those rights that society takes for granted, such as the right to freely use public spaces and the right for equal treatment from government agency. Assure. Oh no. Assure competent. I'm sorry. Public and personal health care workforce. Crisis intervention teams is a community collaboration between mental health providers, law enforcement, and family and consumer advocates. This group examines local system to determine the community's need and agrees on strategies for meeting the needs to organize police training. This coalition also determines the best way to transfer people with mental illness from the police custody to the mental health system and ensures that there are adequate facilities for homeless people with mental illness. Today, the CIT has been adopted by hundreds of communities in more than 35 states and is being implemented statewide in several states, including Maine, Connecticut, Ohio, Georgia, Florida, Utah, and Kentucky. Increasing access to both routines, medical care, and medical insurance are vital steps in improving the health roll of all Americans. A person's ability to access health service has profound effect on every aspect of his or her health. Yet, at the start of the decade, almost one-fourth Americans do not have a primary care provider or health care center where they can receive regular medical service. Access to this health service affects a person's health and well-being. Regular and reliable access to health service can increase quality of life, prevent disease and disabilities, detect and treat illness or other health conditions, increase life expectancy. Program evaluation provides opportunity to gain insight into whether activities are achieving the desired results, improve program service, and provide information to others regarding program success. Program evaluation involves the collection of information that assists stakeholders to better understand the program, improve its effectiveness, and make decisions about future program planning. The U.S. Department of Housing and Urban Development classifies homeless people in two broad categories: sheltered and unsheltered. A sheltered homeless person lives in an emergency shelter or transitional housing. An unsheltered homeless person lives in a place not meant for human habitation, such as cars, parks, sidewalks, abandoned buildings, or on the street. About 44% of homeless people are unsheltered. Research and practice have shown that the permanent supportive housing works because housing is an essential part of treatment. People with serious mental illness need safe, stable, and affordable housing before their mental health needs can be fully addressed and recovery truly realized. Many local are also showing the provisions of housing to this population is cost effective.